Hello, today we are going to discuss vomitings in pregnancy. This is a very common question asked in the examinations. Vomitings in pregnancy consist of two questions. One is a short note, morning sickness or emesis gravidarum, and another one is a long question, hyperemesis gravidarum. So let's move to the question two. So vomitings are or vomiting is a symptom which may be related to pregnancy or maybe due to medico-surgical or gynecological complications which can occur at any time during pregnancy. So, these are the causes in early pregnancy and in late pregnancy. In early pregnancy, as you can see in this chart, related to pregnancy and unrelated to pregnancy. Related to pregnancy, if vomitings are few, then it is termed as simple vomiting. And if excess vomitings are there, then it is called as excessive vomitings and it is termed as hyperemesis gravidarum. If it is not related to pregnancy, means it could be due to medical diseases or surgical diseases or gynecological diseases. Say for example, in the medical diseases, let's take the example, the lady during pregnancy may suffer by hepatitis. उनको हेपेटाइटिस हो सकता है या किडनी स्टोन हो सकता है सर्जिकल डिजीज में और may suffer by appendicitis or maybe suffering by tumors, fibroids in uterus or twisted ovarian tumor. So these all are the associated causes for the vomiting, but these are not related with the pregnancy. And most commonly vomitings are seen in first 3 months, first trimester. But it is possible that vomiting may continue throughout pregnancy till the 9th month. But it is very rare. But if it is there, it is called as vomiting in late pregnancy or vomiting throughout pregnancy, and it is hyperemesis gravidarum. In this time, it may be associated with high blood pressure, proteinuria, edema, which we call it as preeclampsia. Preeclampsia consists of three terms. When a pregnant lady showing high blood pressure, hypertension, plus proteinuria, plus edema. These three conditions together called as preeclampsia. Or again, it could be due to hiatus hernia, or it could be due to kidney stone or appendicitis or peptic ulcer during pregnancy. Means the causes are not related with the pregnancy, unrelated to the pregnancy. So we'll come back to this chart once again later on. Now we'll focus to the short note. Emesis gravidarum. That means simple vomitings or morning sickness. It's a short note asked for 5 marks. Emesis gravidarum, also termed as morning sickness or simple vomiting. Nausea, slight vomiting associated with occasional sickness early in the morning, on rising in the morning, during early pregnancy, during first trimester is called as morning sickness. A feeling of nausea associated with slight vomiting and somewhat fatigue, weakness, fainting sensation on rising in the morning during early pregnancy is called as morning sickness or emesis gravidarum. Symptoms, of course, nausea, slight vomiting on rising in the morning with occasional sickness. Same sentence we have used in definition, you can use as a symptom. Vomitings may occur at other time. It is not necessary that it will be always in the morning. Sometimes she may feel nausea at the afternoon or in the evening. So it may occur at other time. But of course, the vomitus is small. We can say it as a dry vomiting. Or it may be bile stained. It may be bile stained. One correction is here. It is bile stained. The vomitus is small, clear, or bile stain. Next, now what are the causes behind this? So the first and primemost cause considered is excessive human chorionic gonadotropin, HCG hormone, which is secreted during pregnancy by the placenta, which is secreted during pregnancy by the placenta. And second is excessive sympathetic activity. So we consider this as a cause. Now, let's move. It does not produce any impairment, right? ये जो symptoms है, this symptom does not produce any impairment of health. Health में कोई impairment नहीं हो रही है. Means symptoms are so less that she is feeling somewhat sick, but she is not very sick. It does not impair health or restrict to normal. She can perform normal activities. The clinical feature disappears without treatment by 12 to 14th week of pregnancy. Means these symptoms strictly remains for first 3 months. Are you getting? Very good. Now cause high levels of serum HCG, estrogen, and altered immunological state. Estrogen, excessive HCG, excessive estrogen, altered immunological, maybe psychological somewhat, maybe aggravated by neurogenic factors, then management, nothing specific, assurance. We have to suggest taking dry toast or biscuit and avoidance of fatty food, and spicy food. If necessary, antiemetic drugs, and patient is advised to take plenty of fluid and food. So why we have advised to take plenty of fluid and food? Yes, correct. Because as there are vomitings, although the quantity is small, but there are vomitings, so it may lead to dehydration. So to avoid that, we are suggesting to take plenty of fluid and fruit juice. Why we are suggesting dry toast, taking dry toast in the morning? Because dry toast, whatever acid secreted at night will be absorbed by eating dry toast, and it decreases the sensation of nausea and vomiting. And why we are suggesting avoidance of fatty food and spicy food, particularly avoid late night meal during pregnancy, dinner parties during pregnancy, avoid dinner parties during pregnancy, avoid late night meal, because this fatty food and spicy food may be associated with the hyperacidity, which could be one of the cause behind excess vomitings. So we are suggesting these suggestions. That's all. This is about the simple and sweet short note, morning sickness. Do you understand? That's very nice. Good. So let's have a review in short, in 2 minutes. I'll close this slide now. We will discuss like this. So first point, we are discussing the chapter vomitings during pregnancy. Now, what do you mean by vomitings during pregnancy? Most commonly, during pregnancy, some GI disturbances associated with a feeling of nausea and vomiting is seen. And this nausea and vomiting usually seen during first 3 months of pregnancy, but sometimes it may extend throughout the pregnancy and it may be excessive. When it is seen only during first 3 months and that too in low quantity, it is called as morning sickness or emesis gravidarum. And when it is seen in excess, it is called as hyperemesis gravidarum. From student's point of view, emesis gravidarum is a short note and hyperemesis gravidarum is a long question. Today we have focused on the short note, emesis gravidarum. Now, emesis gravidarum means a feeling of nausea and vomiting associated with the sense of weakness or somewhat fatigue during first 3 months of pregnancy. This is most commonly seen only during primary, means only during first pregnancy. In multipara, means the female who delivered many children, this symptom is not seen. आज हम जो टॉपिक सीख रहे हैं इसका नाम मॉर्निंग सिकनेस है. इसमें सुबह उठते बराबर हल्का सा नौशिया और वॉमिटिंग होता है. उसके साथ थोड़ी सी थकान महसूस होती है प्रेग्नेंट लेडी को, और ये सिम्टम पहले 3 महीने होता है, और वह भी सिर्फ फर्स्ट प्रेगनेंसी में. अगर इसकी एटियोलॉजी या कॉजेस पूछे जाए तो नथिंग स्पेसिफिक इज सीन. यू कैन से अ सिंपैथेटिक एक्टिविटी, excessive sympathetic activity due to which profuse salivation associated with nausea is seen, and excess estrogen during pregnancy and excess human chorionic gonadotropin hormone, human chorionic gonadotropin, which is secreted by placenta during pregnancy. So causes में excessive sympathetic activity है, excessive estrogen hormone है, और excessive HCG है. Nothing specific. Symptom में भी we can say profuse salivation, nausea, vomiting. That's it. A feeling of sensation, a feeling of weakness, a feeling of giddiness, fainting, weakness. That's it. Nothing special. Even in management, we don't prescribe antiemetic frequently. If it is somewhat bothering her, then it is if it is becoming somewhat severe, then you can prescribe antiemetics, or else just we are suggesting eating dry toast in the morning, या फिर रात में आप कोई तली हुई चीज मत खाना. अवॉइड फैटी फूड, स्पाइसी फूड, टेक मील्स अर्लियर. रात का खाना जो थोड़ा जल्दी करना, इवनिंग में ही फिनिश करना बिफोर 7 PM, और ऑयली फूड, फैटी फूड को अवॉइड करना है. एंड थोड़ा बहुत कुछ वॉमिटिंग से, ऑल्दो द क्वांटिटी इज स्मॉल, बट वॉमिटिंग्स अगर फ्रिक्वेंटली होते हैं तो हो सकता है कि वाटर लॉस हो. इसको फुलफिल करने के लिए वी विल सजेस्ट द fruit juices and plenty of fluids. That's all about the vomiting during pregnancy, short note, morning sickness, or emesis gravidarum. Is it okay for you now? All right then. For today's lecture, we will stop here. See you tomorrow. Bye bye.